should be done by not directly applying the cold on the skin, but using something like a towel in between. You can wrap the ice pack and then try to apply it to the incision. Well, not in the video. And you can do it for 5 to 10 minutes, depending on how long he will let you do that. Some dogs are more patient, others are less patient. The icing, as I said, is important in reducing the swelling after the surgery and taking away some of the pain and sensitivity that he would have when we are trying to do the passive range of motion.
So how many times a day would you ice?
You cannot overdo it with icing. You most certainly should do it before and after passive range of motion, and otherwise you can do it at least 4-6 times a day. This would reduce the inflammation. As time goes on, he will need less and less of it. The icing is most importantly something that should be happening within the first 14 to 28 days. After that, it is something that is less important. And as I said, now after the surgery, it is more important than towards the end of the month, okay, because of the fresh trauma, of course, of the surgery. And you can see that he's actually letting you do it fairly well. Now, you can use something like one of those packs, or you can use those hot cold packs that you can get at shoppers. You know, the ones that are getting that you can still mold even when they're cold, so you can fit it over the knee a little bit better. Because this is something that works not bad, but it does not pretty much touch the whole area of surgery. So it is a little bit suboptimal. Those hot cold packs are much better because you can pretty much form them to the form of his knee, which means that we're getting more cold into it. So I think that should be probably enough as a rough idea.
Okay.
So, passive range of motion is very important because with joints and muscles, there is a very good rule: is you either use it or you lose it, and we need to maintain the range of motion of the joint in order to ensure that we will be not losing it. It is something that is very, very simple to do, and what you're doing, you're holding on to the paw, and you are just flexing the. I know, hon. Yes, I know. Gently does it. Okay. He's a little bit more sensitive now 1 day after the surgery, but as the inflammation will get reduced, he will let you do it more. If he's very, very painful, you don't do it the first couple of days after the surgery. But the idea is that you hold on to the paw and gently extend and flex the knee. Extend and flex the knee. And as the healing progresses, he will let you flex and extend the knee much better. As you can see, he's already letting me do it better than he was doing before. I think it was a little bit. So this is the range of motion. And it is important to maintain it, because otherwise the results of the surgery will not be as good in the long run. Okay.
Not too bad, is it?
No, it is also, of course, important to restrict his activity levels because we don't want him to pretty much break those implants, which he could do easily. Even with the doubling of the implants, he could still break them. We should follow those instructions on the printout as good as we can. If you have the feeling that he is too uncomfortable in getting moving around, then you just step back and let him dictate the pace.
Okay.
Okay? Good.
Okay. No, all right, let me.
That's it.